If we look at the issue of public-private partnerships, particularly in service delivery, and you take the slum context into consideration, one of the basic strategies that we've adopted is to say, can you create a mechanism whereby the public sector can set the standards, provide support supervision to the private sectors, provide a mechanism of accreditation that can allow the private providers to be able to access other resources, for instance, whether it's insurance repayments or drug supplies or secondment of staff and others. So by working with the Ministry of Health in particular to now come into a relationship with a number of the service providers that work in the slums, it became possible for you to be able to create a mechanism where the private sectors can then provide quality services to residents, because there is a mechanism in place. This is just new at this point, so we are waiting to see how that is able to strengthen the capacity of the private providers working in this system to actually provide better services, but more importantly, whether that can actually lead to the private providers that do not provide quality service folding up, because you have more of the residents being able to access services at the appropriate and approved providers within this setting. We're also currently in discussion with the health insurance provider to see if there can be a health insurance scheme that targets the slum population, and how do you deal with all the other issues that surround that. And that's currently a discussion that's ongoing, but there's been some interest in exploring that particular market, and which we think will be a major contribution to improving health within this community.